I'm Dr. Ulka Nathu. I've been practicing in Thane as a gynecologist for the last 34 years. I was rather little skeptical about joining the course at a little elderly age. But trust my words, this course it was like a dream come true. After many days, in many years, in fact, I enjoyed the student days, and it was really pleasure learning from Dr. Priya because we had lot of lectures, we had lot of hands-on sessions, and we had almost more than 25 demonstrations, live demonstrations of colposcopy. Dr. Priya has taken tremendous efforts to arrange for these number of cases, and a hands-on workshop was also conducted on chicken breast for the lead procedure for cold cauterization. There was nothing left untouched, sort of, and it was really a truly a knowledge giving sort of session, and we have enjoyed every minute of the teaching. We used to start at 9 o'clock in the morning, and evenings we used to get free by 5:30, and never even once we realized how the time was passing by. No, so much we used to get engrossed in the learning process. And Dr. Priya has a lot of patience, and in spite of being at such high level, she is absolutely a personality who is highly approachable. She is down to earth, and she is ready to solve our queries and our doubts to our greatest level of satisfaction. So once again, I thank Dr. Priya for giving us such thorough knowledge of about not only about colposcopy but about CS cervix in general, and about vaginoscopy, valvoscopy, and the other light topics with it. I have bought her own devised instruments. At the same time, I have ordered for a colposcope because I couldn't resist the temptation of buying a colposcope and start doing it on my own. So I have bought a thermoglad along with the instruments, necessary instruments, and a colposcope, of course. Yeah. So thank you, Dr. Priya, for everything. Thank you for a wonderful experience. Hi, I'm Dr. Agalya. I'm a consultant in obstetrics and gynecology, practicing in Karu. It is in Tamil Nadu. Actually, I came to know about this workshop after a fellowship course after I really wanted to know more about colposcopy. When I was searching through the net, this was only West Institute, which shows the where they teach more colposcopy, most colposcopy in India. So I wanted to come here. Actually, what I wanted to learn, I have learned in this course. The thing is, I was not even with the basics of colposcopy. Now I have confidence that I will able to pick up the cases, pick up the lesions, everything. And the hands-on training was very nice. Actually, the day by day, which I can see like from first day to fifth day, I can see how we are getting hands-on, like we are getting more confident. It was very nice to have a hands-on session like this. And actually the ma'am teaching was very nice. From the starting of the day, from the very basics of colposcopy to the higher end of colposcopy, and doing let's and all those procedures in dry labs. It was very nice. Actually, the procedures will be done in dry labs. That was very nice. Actually, what we need in the initial phases of colposcopy is that we have to know, we can't directly do it on patients. So that procedure was very nice. And from the instruments to all, they got us exposed to all variety of colposcope. Actually, I don't know like how many colposcopes are there before I came here. Now I'm able to check like, okay, this is a best colposcope if I want to go for a camp, and this will be the better one. We have practiced in all those four varieties of colposcope, and it is the workshop is basically has achieved this good thing. I wanted to learn, I have learned in the Colposcopy Fellowship. It is very nice actually.
Hello, I'm Dr. Sushmita. I'm from Tenkasi, Tamil Nadu. I'm working in a government setup as assistant surgeon. I came to know this course about Dr. Priya ma'am through Foxy website and through your friend. Um, I was basically an amateur in colposcopy. I was not well trained on the skills and how to report. Everything was new to me. After coming to the course, I have learned from the start, from counseling the patient to ma'am taught even how to place the speculum properly, how to visualize it, how to focus, even small little things she was explaining, and about um, scoring in colposcopy and how to grade everything. She taught in great little details, and I'm very much, I've learned very much in the course. I joined here as 5 days course, uh, fellowship course, and it taught me a lot. I have now become well versed with all the terms and how to proceed with colposcopy. I'm now confident in doing my colposcopy and also the interventions. We were taught about the interventions like thermocoagulation nets, and we were given hands-on. So thank you so much for the wonderful course we were provided. I have searched all India for such colposcopy course, and I could find only ma'am's class to be in such a level in which we can get the benefits from. Thank you.
I'm Dr. Manisha. I am coming from Lucknow, but I work in a nearby place, Lucknow. It's a district Sitapur, where I work in a missionary hospital. It is a busy hospital. We have a good patient load. So I was always in a need. So the patients coming to my OPD should be properly screened for everything. We are having a very good obstetric facility. I also want to give them a proper gynecological solution also. I came to know about this center through some of my friends and then through Facebook. And then I contacted the center. When I reached the center, I was full of doubts and queries how 5 days I will going to manage, what I'm going to learn. But after 5 days, I'm feeling myself in a very comfortable place. It's not a hands-on course, it's a hand-holding course. Your hands are holding. And then you are taught each and everything. Basic speculum examination, then how to use the colposcope, then some operative procedures are also taught to us. Instruments which have been designed here are very nice. I am taking instruments for my OPG purpose also. Some instruments are very feasible and very handy. You'll find that if you have this will make your life easy. Or taking biopsy, for which we have to do such a lot of things, we can easily take in OPD. So it's a very nice course. You will feel very comfortable after going from this place. You will feel like that you've learned a lot, and you have to also learn a lot further. That is why I am taking 1 year mentorship also from the center, so that I am be in the loop of learning. I don't lose my loop of learning and do well in my practice.
I'm Dr. Savita Gangwal. I'm practicing in Lucknow. I came to know about the course from the Facebook, and I come here for that course. The course is actually very good. Actually, there are so many patients we have seen and done colposcopy. The hands-on training, the patient load, that is very good. And the instrument the ma'am used, especially the endocervical speculum and the punch biopsy forceps she is using, that is a peculiarly made by her, and that is a very good course. And I am very happy that I came to do a course. I am very satisfied. Thank you.
Hi, I'm Dr. Shruti Ugran. I am based in Navi Mumbai, and I am working with Motherhood Hospitals in Navi Mumbai and also with MJ Medical College, Vashi. My experience, I was there for a 5-day fellowship program with Dr. Priya, and I had a very good learning. Basically, how I look at cervix is very different now, and I have realized that colposcopy is a very niche branch, which definitely needs more people to take up, and definitely we can together do a very good work. And the instruments that ma'am has patented are really good. We saw the offline demonstration of all of that. And in the period of 5 days, we almost saw more than 20 plus patients with a variety of cases. right from operative colposcopy as well. So thank you so much, and I am really glad that I came here. Thank you.
My name is Dr. Suvarna. I am from Marathwada, Parbhani district. I got to know about this institute on Google. I think when name colposcopy comes, ma'am is everywhere. Within the short duration of 4-5 days, ma'am gave us lots of information about colposcopy. We came here with little expectation. Ma'am gave us beyond that. And Sai Nivas team is very kind. Each and every person of this institution is kind-hearted, helping in nature. And during the course, we get lots of cases, near about 15 to 16 cases.
I'm Dr. Ankita Shahasne. I work as assistant professor in DY Patil Hospitals, Navi Mumbai. I'm also a primary consultant at Raigad district, Maharashtra. And talking about the colposcopy training course with Dr. Priya, Ganesh Kumar sir, madam, sorry. It was excellent. It was absolutely excellent. There's so many new protocols that I got to know about emphasis of HPV DNA. Before sending cytology, the importance of that was understood, and I really enjoyed it. I understood. Maybe I will never see the cervix the same way I saw it before. And this is something the take-home message is, treat cervix as independently as you can. Obviously, holistic approach is what we talk every time, but there is so much to see in the cervix itself, which, in spite of, being qualified, I had no idea about, because we were not exposed to it during our residency. So yes, I'll be definitely going back, and I'll start doing colposcopy. I'll train my residents in colposcopy, and it was truly a phenomenal experience to be here. Thank you.